Hi, my name is Josh. I'm a lead data architect at Blue Margin, a data analytics firm located in Colorado. I'd like to spend the next few minutes discussing the benefits of Healthcare HQ, which is a comprehensive approach to healthcare analytics. Healthcare HQ was developed to answer specific pain points for this industry. Healthcare carries some unique challenges, especially now, and responding to those challenges requires information. Oftentimes, that information can be spread across the organization, between EMRs, PM systems, or even Excel files. Healthcare HQ is an approach to bringing value and clarity to those who need it, when they need it, and allowing more time to be spent making critical decisions. Whether your need is operational, like coordinating people, controlling for case mix, or increasing production, or financial, monitoring your overall RCM health, analyzing your fee schedules, or tracking and acting on your accounts receivables, Healthcare HQ is designed to allow you that freedom. In working with dozens of organizations, we've seen it also bring organizational and cultural benefits, including better role ownership, clearer expectations, and shared accountability. With Healthcare HQ, we've seen networks become proactive rather than reactive through measurable performance tracking rather than trekking through the fog of war. As an example, I'd like to demonstrate 3 RCM-focused pages for a healthcare company we'll call Blue Core Health. As practices are moving toward patient-centric RCM, one of the largest needs is answering those patient questions quickly and transparently. In this scenario, Blue Core Health has received patient feedback of what seems like surprise billing. In their investigation, Blue Core suspects they're being underpaid from a few payers, which is having an impact on patient balances. They'd like to figure out why and how to correct this. So using Healthcare HQ, as an executive, I'm able to see several things right away. One, I can track my gross billable during this time frame. I can see exactly how much we're charging and how much has been invoiced. I can also see my expected revenue. This would be the allowable revenue based on my contracts and fee schedules with the payers. And finally, I can see my actual revenue. This would be the revenue that has been adjusted down after pre-submission adjustments. And finally, I've got my variance, which right now organizationally sits at about 20%. So I'd like to dig further. One thing I can see is my overall trend during this time frame for my whole organization, which would include all sites and facilities. Below that, I've got a box for variance by facility. What this will do is show me the dollars and conditionally format by the variance, so I can see not only which facilities are suffering the most in loss of dollars, but also which facilities are furthest away from my fee schedules. Right here I can see downtown is losing the most money, but due to that conditional formatting, I can see PBD emergency services is actually furthest away from the fee schedule. So I'll click on PBD emergency services. What that will do is cross-filter this whole report, so now I'm looking at every metric specific to PBD emergency. And immediately I can see next to it my variance by payer. Blue Cross Blue Shield is both underpaying by the most amount of money and is furthest away from the fee schedules. I can then once more click on Blue Cross Blue Shield, and I can get more information, both about the procedures that we're being underpaid on, so I know exactly which fee schedules to target, and by the adjustments. I can see up here in the top right, I'm losing the most amount of money to a timely filing limit adjustment. And this is something that I can control. So whether I'm understaffed or whether I need to train, this is an action I can take right away. And in this box below, we've listed the actual claims that are about to be submitted that I can go take action on. We've also added to Healthcare HQ a visual representation of the claims process. In this case, we've built the visual representation in Visio and embedded it in the Power BI report. I can right-click on PBD Emergency Services, drill through to Visual Claims, and I'll be able to see all of the PBD Emergency Services claims flowing through the process, and I might be able to identify who or which department needs the most attention right away. As you can see, I've also been able to add specific metrics alongside that visual representation, so I don't lose sight of the trend and where we're losing the most money. In this case, the visual representation acts almost like a heat map. I can see that every single one of my claims, from creation down to submission, follows the same trajectory. And there may be a point in here or a person in here that could require training or some support. Finally, we can go look at accounts receivable. What we've done with Healthcare HQ is allow you to move backward in time to see what your accounts receivable looked like 3 months ago, 6 months ago, 9 months ago, and get a good sense of the direction each facility or each AR bucket is taking. In this case, I can see for this time frame, downtown has the highest outstanding AR. Moving backward in time, this all will change because I'm using the dates out of my EMR, things like payment date, invoice date, adjustment date, and I've applied them differently so that I can see backward in time whether or not I've increased or decreased that AR bucket, or if my standings have dropped. So in this case, PBD Hospital, about 6 months earlier, had the second highest outstanding amount by facility. Now we fast forwarded in time, and I can see the PBD Hospital is now third in the list based on the insights we've been able to gain through Healthcare HQ. We've taken proactive steps to start working on those balances, and we've been able to staff up and train our people as needed. So as an executive using Healthcare HQ, I've been able to find a few things in just 5 minutes. I've been able to understand my organizational variance, identify my most at-risk facility, understand that facility's variance as well as the trend, identify the payer with the highest underpayment, identify the underpaid procedures and the dollars associated with those, as well as find the fee schedules associated with those. I've been able to identify a potential reason for that loss and identify a list of claims that can act as a work list so that I can go and make corrections as needed. I've also been able to monitor my AR throughout that time, and I've been able to visualize that process so I know exactly where to target some solutions. This was just a quick overview of how Healthcare HQ can help. I'd love to meet with you to discuss your specific situation. You can find me and our team at our website, bluemargin.com.